Hi, Dr. Kenneth Hughes, Los Angeles plastic surgeon today in my office. Just going to go through some Bodytite considerations. What's Bodytite? Bodytite is a minimally invasive skin tightening and tissue tightening technology, and it utilizes radio frequency energy. Now, the energy, as far as where it starts, what it becomes, the final common pathway is heat in all of these, okay? And the heat is responsible for causing tissue contraction, which causes the skin to ultimately remodel and the subcutaneous tissue as well. And so what you're doing is with that contraction, you're getting a tightening effect, okay? Without the larger incisions of the excisional surgeries like tummy tuck, arm lift, thigh lift. And so Bodytite ends up being used on those areas, like I mentioned, the arms, the tummy, the thighs, the bra roll, the face and neck. The Bodytite's counterpart is Facetite, and it utilizes the same technologies made by the same company, Mode. So you have Bodytite and Facetite. Now, some of this is a little bit misleading because a lot of what Bodytite does, at least the way I use it, I'm basically doing a lot of corrective or revision surgery. And so a lot of that is liposuction revision or something of that nature. So for instance, let's say a patient comes in with an abdomen that's been liposuction maybe once, maybe twice, maybe 5, 6 times. And so there's this issue with residual lumpiness, dents, divots, irregularities, uneven contours. It's a displeasing aesthetic appearance. And so what do you do with that person? Well, it depends on the relative degree of skin laxity and whatnot, but a lot of these people, the skin is kind of conformed to the underlying scar tissue, and so it has this memory involved, and sometimes there's not enough tissue or laxity as a result of the very, very exuberant scarring. And so even though a patient may have had some skin laxity or doing a tummy tuck initially may have improved this, over time what's happening is all of that scar tissue from multiple surgeries has created a very, very unyielding skin envelope, and so you may not even be able to do a tummy tuck in those patients, and so that can be frustrating as well. But let's say a patient is trying to avoid a tummy tuck scar. So then what you're doing is you're going in, you're re-elevating the flap. The flap is usually non-uniform, that's why it looks so bad. And so the first goal is to create a uniform flap. So if it's like this, like that, you're trying to smooth that out so that it can adhere and hopefully get a better result. Now, that doesn't mean that the patient will necessarily heal it as well as you do it on the table, but you're giving them the highest probability to do so. Now, Bodytite can be used as an adjunctive measure to basically kind of conform the skin area. So for instance, if you have a hill or you have too much surface area for the underlying surface area that's commensurate with the abdominal wall where it should be, okay? So in other words, let's say that the skin normally is, kind of a 1-to-1 relationship on the abdominal wall, like most people, okay? But over the years, time, age, maybe weight gain and loss, pregnancy, there ends up being more skin. And so more skin it can only stick down a certain way. And so it generally creates, a wavy appearance, or there's hanging skin or something of that nature. And so what you're trying to do with Bodytite, even in these revisions, is you're trying to create that heel. You're trying to bring that heel in, okay? So you're kind of getting that circumferential pull, and with that you're basically decreasing the surface area of that overlying skin or skin envelope so that it has a better chance to stick to the underlying abdominal wall. Now, while the technology is good, it's maybe 40% average. Now, what does that mean? That really means that there's probably a great deal of variability patient to patient. I noticed that as well. I think some of the patients don't get nearly as much benefit, maybe 20%. That's irrespective of execution and procedure. I think it has to do with healing and how a patient's tissue responds to that heat, which is causing the contraction. So some people heal very well and they're very responsive to technology, and there's no question that they may even get a better than 40% improvement, but that is very hard to predict. In fact, you can't predict it going into surgery. So then the issue becomes, well, what do you promise somebody? You can just say that it's about an average of 40% improvement. So it will never reproduce an excisional surgery. So a person who has more laxity, I almost always tell them, hey, look, this is the better procedure for you. Now, some of them will still say, well, something's better than nothing. And it's hard to disagree with that. But it's also, you have to inform patients appropriately. And so a lot of what I spend time doing is, trying to make a patient either consider that this is less likely or the probability is less likely. And if they still want to proceed with that, that's fine. But Bodytite and Facetite the two technologies, they have their limits, okay? And so you can only expect so much, and so realistic expectations are important. And now, something else to consider, and patients frequently don't consider it, is, where do they fit in the gamut of the skin laxity or the healing or genetics or things of that nature? Some of that's hard to predict, okay? Like I said, the healing's hard to predict. How someone responds to technology is hard to predict. But if you have a lot of kind of, crepey type skin that's kind of, has a lot of stria and has, not the best tensile strength and maybe isn't as thick. I mean, there are a lot of different things that you can consider there. But some of those people, you can look at them and you can tell they aren't going to get as good a result. But for areas like, around the elbows or the knees or things of that nature, they really can't tolerate a scar in that area or don't want it. And so you're willing to do the Bodytite in those areas because they will get some improvement. Doesn't mean you still can't have complications with this. What are the most common complications? Well, you can get burns, okay, skin burns. They're nothing like some of the burns that I see with other areas where, like whole sections are burned or there's, just hundreds of burns. But it is possible to get small little pinpoint burns from the device, and that's because no device is ever perfect. Even if you're utilizing it exactly the way it should be, dragging along, it can suddenly, have energy spikes. Now, I don't think it's very common. It hardly ever happens, but it's something to be aware of. The other thing is, and I think the main thing about Bodytite is probably just people not having realistic expectations. That's probably the number one complication. But let's say you can also get fluid collections. Just like with any procedure causing heat or causing tissue damage, you can develop fluid collections, whether that's the abdomen or, it's more common in the abdomen, let's face it. I mean, it's much higher, but it can happen in other areas as well, and I've seen it happen in other areas, but it's just not as likely. And so those are the main risks with the Bodytite. And then sometimes people ask, well, why is Bodytite better than something else? Well, there's never going to be something perfect that causes, this one-on-one contraction, almost creating like a black hole or something like that. As far as the volume, the mass getting larger and larger and the volume getting smaller and smaller. So ultimately what you're going to have to decide on the technology there is which of these technologies offers the greatest efficacy with the least amount of risk. And I think Bodytite does that really well with it. Has a bipolar technology, it has two poles, it concentrates the energy. This is different from the other devices. So I think it's more efficacious, and then because the probe is small, and because the way it disperses the energy and concentrates it, rather than being a unipolar device where it disperses kind of in this, kind of everywhere dispersal, I think it, number one, it's not as effective, but number two, greater risk for burns. And so part of how you encapsulate that technology determines how effective it is, but also the relative risk. And so I think Bodytite is a better alternative, at least at this point, than any of the other technologies offered.